guys, welcome to my podcast. This is Paul Delegro with Business Brains and the Bottom Line. I have two guests today. John Cappelletti, he's a director of vendor management of non-merchandise supplies at a very large pharmaceutical company here. And I also have Peter Antonelli, who is with Curran and Antonelli, law firm in Boston. And so I know what you guys are going to say right off the bat. Okay, we get three guys that their names end in a vowel, and that is accurate. We're all Italian, but more importantly, we're all first cousins. So welcome to the show, guys.
Hey, thanks for having us, man.
Yeah, no.
Glad to be here.
How you doing, Peter?
Great to be here, Paul. Glad
Thank
you
you.
invited me.
It'd be a lot of fun. So the reason why I asked you guys is, with this all this craziness that's going on in the world today, I thought you guys would offer some great perspectives on the COVID-19, how it's affecting the healthcare industry in your case, Johnny, and obviously Pete on the legal aspect of it. I know you do a lot of bankruptcies. So I think you have had a huge uptick in bankruptcy. So, I'm in IT sales, right? So I kind of know the impact from my end, but I thought it would be an interesting take to see you guys and hear what you guys had to say on your perspective of what's going on and where you think this thing is going from a healthcare perspective, a life perspective, and a legal perspective. That makes sense?
Right. Sounds great.
Well, it does.
John,
Johnny,
I think you better go first.
What's that?
So,
John, I think you better go first.
I don't know. I think the first thing I would say is that life as we know it is officially changed. I think I'm working in my home. I'm working in my dining room, right? I already worked 13, 14-hour days. I get up in the morning now. I come downstairs. I get right to work. I'm working until 7, 8 o'clock every night. And then I'm checking my email and my work, my meetings and prepping for the next day, like before I go to bed at, 11, 12, whatever time it is. And I think everybody's doing that now. I think you're either kind of sitting around watching TV or trying to keep yourself busy or you're working, right?
Yeah.
And so behind me, I have a television set, and I sometimes in the morning put it on and I leave the news on, and I'm working away and I'm trying to keep myself motivated. And then I hear in the background the the CEO of Twitter announced that to his employees that he was never going to have them come back to the office, that they're going to work from home moving forward. Yeah. So it made me think a lot about it, things like that. For instance, movies that they're shooting today in Hollywood, I think the characters are going to have masks on now for present day movies. Life's different, right? It is. I mean, it's really, it's like we're copying that movie Contagion years ago with Matt Damon, and it came true, right? So I don't think it's ever going to change. I think people are going to continue to be conscious of it. In my industry, we focus on seasons, right? So in the fall, which is not that far away. I mean, we're in ramp right now. We're going to have open enrollment, and we're going to have what we call AEP, which is annual enrollment period for seniors, and then welcome season for people our age, right? At least for now, right? And so we're 65. And also what comes in the fall, guys, is flu season. So if you talk to any medical professionals, and this is an important factor, and this will come up a couple of times in our discussion tonight, but people are looking at data now more than ever, right? So then what I mean by that is how are hospital admissions? How many deaths, COVID deaths do we have? How many infected patients do we have? People are watching that very closely, trying to determine how to open up a state or bring things back, right? What's going to happen if we go storming into the fall and the flu season comes and COVID comes back? Meaning we clear it, we open up the cities, the major towns and cities, and we start getting back some normalcy to our lives, and then the flu season comes and then COVID comes back. Maybe even a different strain of it. And I'm not trying to be pessimistic, right?
No.
But I'm just saying, I think things have changed, and we're going to see a lot of this for years to come, probably.
Yeah, no, I agree, and I think that would be the worst case scenario, Johnny, is if it ever came back in the fall. Because I think
Yeah.
that the premise now is open up states slowly, protect the people that need protection. That's what we're doing here in Texas, right? That's why our death rate's pretty low and our infection rate is pretty low, because they're really doing a good job of protecting the people that need protection. And
I think that's right, by the way. You have to open up the economy. You can't,
yeah,
it's the right move.
Yeah, because the damage that the solution is going to provide is probably going to be worse than the COVID-19 itself. I mean, so many lives are being ruined, but
right.
Good perspective from you, Johnny. I appreciate it. Peter, so you and I had actually talked about this earlier, but I'd like you to talk about, what you're seeing in the business community, because you said you're kind of going full tilt on bankruptcies right now. And so you've got your hands into a lot of businesses that are really in trouble. So what do you think?
Yeah, well, I think, picking up what Cousin John said, fundamentally you have this thing that you can't see, you can't touch. It doesn't have an army. It doesn't have a tank. And in a matter of weeks or a month at most, it completely transforms everything that we've taken for granted in our lives, right? You can't do your typical business commute. You can't operate your business in the way you want to operate it. You can't go to sporting events. You can't have sporting events. You can't take your kids to their sporting events. You can't go to schools. You can't go to restaurants. You can't go to churches. You can't. It completely disrupts everybody's lives around the world in a way that no one ever expected. And I'm going to be 50 this year. You guys are a little bit older than me, and wow. I can't point
Jeez.
to. Yeah, and I'll never catch up with you. How about that?
I would love to be 50 again and know what I know now. Let me tell you.
But you
look good for an old man, Johnny. You do.
He does. Yeah, you look great, even though I can't see you on this. But
yeah, 57.
You sound great.
The other day. Yeah. Thank you.
So, it's very hard to wrap your arms around something like this from a social, personal, let alone business perspective, even with everything that we've lived through, 9/11 and, the Great Recession and the first Iraq War and all these other things that we've seen over the years, right? I was a kid when we had the oil embargo and there were gas lines, and I vaguely remember that. So when you come to businesses, I think you got two ways to look at it. How do you react? How do you react and recover from the shutdown, which has gone on now for 2 to 3 months?
Yep.
And two, how do you operate in an environment when there is no quote unquote shutdown? There is no, we're quote unquote open for business. And I think businesses are going through those processes. One, recovering and reacting to not having revenue in this shutdown period. And some businesses are deciding, and you're seeing it on the news, and I've seen it anecdotally, they're just not coming back.
Yeah.
And then secondly, the other perspective is, all right, you reopen your business, and what are the new costs we have to entail? We have to have sanitary type protections for our employees and all sorts of other costs. So it's really an interesting dynamic that we face.
So Pete,
what'll be really interesting is seeing what the vendors do. From my perspective, it's been really interesting to watch how some of the really good vendors, and Paul, this has impact on you, how they're behaving and how they're trying to sell in this environment. As you guys know, I manage a pretty significant amount of spend. and I have a lot of vendors, and some of them are really rising to the occasion, and they're trying to sell for today. They're not trying to sell in their old way, expecting to get business out of it. And it's a very different environment now because everybody's home. They can't go in and work the crowd and make a sales call and carry their bag and, try to physically meet with people and have lunch and do everything that you would normally do. It's a new environment now.
Yeah. Crazy. So Pete,
right?
You're doing a lot of bankruptcies, obviously, right? What are your customers asking? And obviously we don't want specifics about companies, obviously, but are they just doing reorgs? Are they shutting down business? What are they looking to do? What are you seeing out there?
Yeah. So if you think about bankruptcy, there's really two constructs. One is liquidation. That is Chapter 7 of the Bankruptcy Code. And the other is reorganization, restructuring.
Right.
And in both cases, you can have business liquidations and personal liquidations. Same thing for reorganizations. Individual can reorganize their debts, come up with what's called a plan in bankruptcy, and repay debts. I think what I'm hearing from a lot of the people in my industry, other lawyers and practitioners, is right now, other than the big bankruptcies that you're seeing in the newspapers, which my firm is not involved with, other than those, we're really in a period where it's too early to tell. It's too early for smaller businesses and individuals to pursue the bankruptcy process. And there are several reasons that are driving that, but it's really not surprising. There's a number of protections that are out there for individual, personal, and business debtors, right? You have unemployment insurance, you have PPP program, you have the SBA has another lending program for emergencies. You have the additional CARES Act payments that the federal government has been paying out to individuals. So, and you also have relationships amongst businesses, landlords, tenants, borrowers and their mortgagee banks, where everybody's sort of like, well, okay, we're in this period of this 2 to 3 month period. Let's see what's going to happen. We're not going to try and throw you out in the street. There are other protections, like in Massachusetts, they enacted an eviction and foreclosure moratorium, so you can't legally foreclose and evict people right now. So there are all these protections, and there are all sorts of informal forbearances and agreements amongst parties to, all right, let's just sort of wait and see. So I think we'll hit an inflection point probably in the next 60 to 90 days, where small businesses make decisions about, okay, well, I opened this restaurant and I borrowed $250,000 to build a restaurant, and there's no way it's economically feasible. And oh, by the way, I took out a $200,000 personal guarantee to back that investment in the restaurant. What am I going to do now? And so there's decisions that restaurant owner is going to make, that the bank that lent the money is going to make, that the landlord that is less letting out the restaurant location is going to make. And I think after that period expires, you'll see a lot more crystallization of what's going to go on for bankruptcies, other than right now, which is really predominantly big bankruptcies.
Yeah, it's and you're right. Everyone's getting a little forgiveness right now, but at some point, it's going to have to give, right? Because the banks that you owe money to are going to eventually say, okay, we'll give you a few month break, but now that's up, you got to start paying. And the restaurant owner, the small business owner is going to say, well, my business is way off, I can't afford you, and that's when it's going to hit the fan, I think.
Right.
For sure.
Yeah, and for both, for smaller businesses and for individuals. And
I just saw today Steak and Shake closing 10% of their restaurant, just shutting them down.
Yeah.
Really?
Yeah. And it's in the hundreds. It's not, they're a pretty big franchise. So crazy stuff, John,
and one point on that, and John's probably seen this because he's in, a Fortune, I don't know, what is it, John? You're at a Fortune 50 company?
I think we're 7 or 8 in that range.
Yeah.
Okay.
Fortune 50 if you want.
So
definitely.
Hey, John, by the way, not to interrupt Peter. Johnny, vaping's bad for you, by the way.
Well, thank you. I appreciate that. That's always deterred me in the past, Paul. Thanks.
I know. Well, with cigarettes,
typically I only do things that are bad for me.
Yeah,
Thank you for pointing that out.
I know that about you, by the way. That's why I figured I'd bring it up.
You do know that about me. There's very few people. My wife, you, Peter, people who are close to me. Yes, they do know that.
He's only doing that because they told him he couldn't smoke.
Yeah.
No, I did quit smoking. You have to say it's better that I'm not smoking any of that aftermarket stuff. It's something that's at least,
Yeah.
So
I'm being really bad.
Yeah, it's all natural and it's very low milligram nicotine. It eases me away from, and it's been 5 years that I haven't smoked, so I'm a lot better health-wise because of that.
Well, good. It's good to hear.
Yeah.
So, Peter, I know I interrupted you, Pete. Go ahead.
No. The other thing I would say is pointing to Johnny is that bigger companies use situations like this to undertake restructurings that they've been holding off on. So you see that in big businesses, right? You see,
right.
If everybody, 5 of your competitors are laying off 10,000 people or a big chunk of their workforce, and you might use that as an opportunity to reorganize or to shed leases in restaurants that are not performing. If you're a big restaurant, you see what I mean? So you might see bankruptcies that are strategic, that are maybe unrelated to COVID, as things kind of move forward.
Yeah, I think a lot of companies are going to use it as an excuse, Pete. Hey, we needed a layoff, we needed to cull the herd and get a little leaner, so they can blame it on COVID and get use that as an excuse, I guess. So
that's definitely possible. I mean, for us, we're hiring. We've been hiring, so at least for now. Could that change? Sure, but. I think healthcare, for many reasons, is thriving right now in some ways, obviously. We've made some very positive decisions on behalf of the people, on behalf of the patients, to try to care for them and help them financially, which has been something I'm proud of my company for doing. But, to the points that Pete was just hitting, I'm not sure it's going to help.
Yeah.
I think a lot of people are going to lose their homes. I think a lot of people are going to struggle because, to your point, Paul, those gestures that the government is forcing, and in some instances businesses are, stepping forward and saying, hey, we want to help. They can't do that forever,
right?
Because they'll do it at their own peril, right? So, there are going to have to be decisions made in the coming months to put those very same people back into a payment plan. And hopefully the economy will come back, and I want nothing more. And by the way, I know I said it earlier that the fall could be risky for us, but I was really being realistic about the possibility. I certainly don't want that. I also have a daughter that's in healthcare and is a nurse. You know that. You guys know that. So every day she leaves the house, and I watch her leave, and, I tell her to have a good shift. And as a parent, I'm worried to death, and then she comes back into the house afterwards and re-enters this household, which is essentially a quarantined household.
Yeah.
And we have to bring her back in, right, every night. And we have a process where, she takes off her clothes and takes a shower, and, we have this whole thing, but it's really tricky, right? I mean, but at any rate, there's a cost for all that, right?
Yeah.
Like I was saying a minute ago about vendors, I have vendors that are asking, for more money now on the same stuff that, I paid X for, I'm paying Y for now, because it's a lot more to operate their facilities now. They've got to take temperatures. They've got to keep people 6 feet apart. They've got to be constantly wiping down surfaces and doorknobs and banisters. And there's a cost to that. And so that's all I'm saying. I mean,
Cost of goods went up.
Those dollars are, they're going to have to be paid. I mean, it's not free. Economic relief aside, that can't go on long either, right? The government can't afford that much longer.
Yeah. So, I think we're all in kind of a period of just the unknown. We've never faced this before.
Yeah.
And you're right, Pete. I mean, they can cut all the trillions of dollars worth of checks to us if they want, but eventually we've got to pay that money back. And I know the interest rate's pretty low on that and all that good stuff, but still at some point, we're going to be in trouble if this keeps going on.
Well, it's not us. It's our kids and our grandkids and our great grandkids that are going to be the ones that pay that back.
Right.
And, I think that's what kind of bothers me when, we're not really discussing the implications of all this debt buildup. We're talking about it as if it's us paying it back, where really, it's the future generations. Regardless
and they'll blame us. They'll blame us for it.
Oh yeah. Yeah, but we'll be dead.
And it's changing their reality too, right? My son has a scholarship to a Division I school. He's playing football. They canceled the spring season. The fall is in peril right now. They may cancel next year. The NCAA, we're waiting to hear. And he had a job lined up in Manhattan. And he was going to move there. That's all done now. None of that's happening. So everything's changing for him. He spent the last half of his junior year, which is as you guys know, it's a big year for a college student. There's a lot to do, a lot going on. Very important to him. For him, he came home right after spring break. He was in Cancun, and he had to go into quarantine. So, at least he had that. So listen, our kids are fortunate, but it is going to change their lives. It is really going to change their lives. Yeah.
I meant to ask you this earlier. You obviously have a pretty big team working for you, right? A lot of direct reports. And how's that working out doing this remotely where, you're used to working in a corporate office with, having meetings face to face. I mean, how are you guys adjusting to that? Because like I said, different I work for a small company, so it's 15 people in my company and I can, a little bit more intimate. When you work in a big company, if you're not seeing, kind of hard to manage if they can't see your face.
Yeah. Listen, it's challenging, but it's going great. I mean, so I had a full team meeting this morning. I'm having a full team meeting every week. I meet with my leadership team every week, one-on-ones, and then I have a senior leadership meeting where all my managers are together and we talk about challenges and things that are going on. I'm constantly asking how they're feeling, how are their families, and I've told them all, work's important, but you need to take a walk at lunchtime. You need to spend time with your family. You need to, balance, right? And keep things kind of balanced for yourself. And I think that's working, and I'm giving them the autonomy to get their job done. They're all adults. Yeah. They know what they need to do. And, but I'm trying to stay close, and I'm trying to offer them my support as much as I can. And it's hard. It's challenging for sure. But, to their credit, they didn't skip a beat. We got sent home on a Thursday, and, we had, knock on wood, we haven't missed a project or a job. And, we're doing a lot of things to support, testing and all that stuff. And we've had to do a lot of it very quickly, very, very quickly, sure. and in very unusual circumstances, obviously, as you guys know, with the way things are right now. And they've really come through. So they're resilient. They did well. I think they miss being in an office. They miss that human interaction. And I think, that's going to get worse as time goes on. And I think, and I don't want to really go into too many details, but we're not going to be going back anytime soon to the office for a number of different reasons. So
I'll tell you, I think
it is what it is. So
I think one of the fallouts from this, I think companies that are renting a lot of real estate are going to start realizing, wait a second, we can be as effective if, maybe 50% of our workforce works from home. And they're going to say, hey, I'm renting, you know, hundreds of thousands of square footage in the downtown Manhattan, right? Well, why do I need to rent all that space? I think Manhattan's going to be.
That's right, Paul.
Really hard.
That's right. You're right. You're absolutely right, buddy.
Yeah.
That's absolutely going to be the case. There, people are evaluating that right now.
Yeah.
They're crazy if they don't, right?
Yeah. No, why wouldn't they? And again, I think when you're making money, everything's great, right? And then all of a sudden you have situations like this where all of a sudden you can start looking at the bottom line really hard. You start looking at every nickel you're spending. And I think real estate's going to be a big one. Labor and real estate.
For sure. It's a great time to buy a house. It's a great time to refinance. It's a great time to buy a car. There's a number of different, you know, products that you can really, I mean, I really wasn't in the market for a car, but I think I'm going to buy one. My boss just sent me a beautiful picture of a nice car she just bought today or is buying. You know, you can make some really great deals and you can do it over the phone. And that's what I meant earlier when I said things are changing, right? I think things are going to be very different in the future now.
Yeah, completely agree.
We're going to be able to do things without human contact much differently than we used to.
Yeah. Well, cool.
Yeah.
Well, if you guys don't have any last words of wisdom for the show, I appreciate you guys would on my first guest, and I figured I wanted to keep it in the family, right? I wanted my two cousins.
We're flattered. Thank you.
To be my first guest, and like I said, don't know when we'll be publishing this, but we'll get it out there soon. And you know, I should have hopefully a long list of guests. But I appreciate you guys coming on. Thanks again, and hopefully I'll be up to Boston soon. Hopefully this summer, but I don't know if that's going to happen. I got to go see my mother at some point.
Yeah, right. How are you going to do that, right? I mean, there's no flights.
Yeah.
Or very few, right?
Yeah, very few. So.
But we'd love to see you, man.
Yep.
Boston misses you, Paul.
Yeah.
Who does?
I'll even come meet
Boston
you
misses you.
Yeah. No,
yeah. There's one thing about us Northeast Italians, you know, our strength is in our numbers, right?
That's right.
So it's okay that you're in Texas, but if we get in a jam, we need you to come home.
I'll drive up if I have to, Johnny.
All right. I appreciate that. Yeah, I believe that. And you know, we have your back too. If you needed us in Texas, we'd be there in a second.
Well, we're enjoying it down here. They're opening up the state. We're getting back to semi-normal. Gyms are opening up in about a week and a half. We'll see how that looks.
Oh,
I don't know.
That's awesome.
So yeah, we're getting
amazing.
Getting back to normal. So well, thanks again, guys, and we'll talk soon.
All right, boys.
Thank you, guys. All right, man. See you guys later.